What did the report find about how HRT use is changing?
Yeah, before we published our report, there was a study published in JAMA in 2024 that looked at trends in HRT using NHANES data from 1999 to 2020. So their study ended just pre-COVID, and they found that by 2020, HRT use had declined to less than 5%, and the greatest decline came from women aged 52 to 64. And they observed this decline across all racial and ethnic groups. Of course, not surprisingly, women in minority groups had even lower prevalence of HRT use. So in our report, we were able to use newer data through the end of 2024 and account for the pre-COVID years, during and post-COVID. And we looked at all data from 2017 through 2024. This is a really big sample size, nationally representative data. And I believe for each year of the analysis, we had anywhere from 5.5 to 8 million women. So we started just by looking at women over the age of 40, and we restricted it to those who, at least on paper, would be eligible for HRT. So this excluded women who had any contraindications like history of breast cancer, ovarian cancer, stroke, coronary heart disease, deep vein thrombosis, a few other conditions. This was intentionally like a very conservative estimate of eligible women because we chose not to restrict the sample to those with a documented menopause or perimenopause ICD diagnosis code. Those codes are notoriously underdocumented, so I think we would really be limiting ourselves there. Not to mention, there was a study that found that, women with a menopause-related ICD code were more likely to report menopause treatment. So again, we don't want to bias our findings towards patients that are actively receiving HRT. We want to show the good and the bad. And, that's sort of the nice thing about real-world data. It shows what actually happens at the point of care. So what did we find? The main takeaway is that HRT use among eligible women is increasing. That's good. In 2024, we saw that 11% of the women in our study had an HRT prescription. So that's more than double than what was reported in 2020 in that JAMA article that I mentioned. That 11% was among women aged 50 and older. When we looked at women aged 40 to 49, the rate of HRT was about 5% in 2024. And I should also note that the spike really started around 2022. That's where we see sort of a notable upward trend. Our team is now finalizing the 2025 data, so we should have those numbers again soon.